Expecting a baby is one of the most joyful experiences in a woman's life. You're at the beginning of your journey to motherhood, and there's a huge amount of responsibility that goes with that.
I realized really early on when I was expecting that my body is going to be my baby's first world. And it's a real no-brainer to try and be as healthy as possible for her.
However, have you thought about the health of your mouth during pregnancy?
When you first get pregnant, there are so many things to stay on top of, like blood tests and urine tests and all these other tests. Going to the dentist was the last thing on my mind.
Is paying special attention to your teeth and gums really that important during pregnancy?
Pregnancy causes a lot of changes in your body. Some of these changes, for example, are hormonal changes. You might have morning sickness, and you might have food cravings, and these can all impact on your dental health. So if you have gum disease, pregnancy can actually make this worse, and it can affect the health of your baby both during pregnancy but also after the birth. So a healthy mouth is very important during pregnancy, actually just as important as taking folate, for example. And if your mouth's healthy, you're more likely to eat healthy food. Every time you bite into something, you don't have pain. And even better, you're going to have a lovely smile.
I had no idea that dental health could impact my baby.
Neither did I. So what should I be looking out for as signs of gum disease and tooth decay then?
The signs of tooth decay and early gum disease are very straightforward. The most obvious signs are that your gums are red, swollen, or bleed easily. You may have loose teeth, missing teeth, teeth or gums that are sensitive, white spots on your teeth or along the gum margins, holes or cavities in your teeth, toothache, and bad breath. If you have any of these, you must go and see your dentist. Most dental problems are treatable. It does not matter if it's your first child, your second child, or even your fifth child. It's never too late to improve your dental health.
But I thought things like bleeding gums were normal when you were pregnant.
Your gums can bleed a little more when you're pregnant, but bleeding gums is an early sign of gum disease. If left untreated, it can lead to severe gum infections, which could cause problems both for you and your baby. 4 out of 10 women will suffer severe gum disease during pregnancy.
So what can I do to look after my teeth and gums and make sure I don't get gum disease during my pregnancy?
It's actually really, really simple. In order to maintain good dental health, you need to eat well, to drink well, to clean well, and to stay well.
It is really important to eat well during your pregnancy, not only for your health, but for the health of your growing baby. So what does it mean to eat well? Try to choose a wide variety of nutritious foods, lots of colourful vegetables, some fruit, some lean meat, poultry, fish, also legumes and eggs. Choose whole grain wherever possible, and of course include your dairy foods. Limit your intake of sugary foods, as these often contain lots of calories and not much nutrition, and it may lead to unwanted weight gain or risk of tooth decay. Just be balanced, choose fruit, nuts and cheese instead of that pastry or muffin. Drink plenty of tap water because this contains fluoride, which helps to strengthen and protect your teeth. A glass of milk is an excellent drink choice. Limit your intake of fruit juices and soft drinks because these are acidic and contain lots of sugar. And a better choice is to choose the fresh fruit instead of the fruit juice.
Is it true that we also need to make sure we clean our teeth properly?
It starts by brushing twice a day, morning and night. Use a regular brush or an electric toothbrush with soft bristles and a small head. Apply a pea-sized amount of fluoridated toothpaste. Brush for 2 to 3 minutes, not more, not less. Clean in between your teeth with dental floss or interdental brushes. And remember to clean your tongue. And do not forget to change your toothbrush or the head of an electric toothbrush every 3 months or every season. It takes about 12 hours for decay-causing bacteria to multiply so they can stick and start growing on your teeth and along the gum margins. This leads to cavities and gum infection. But if you brush your teeth at least twice a day, you break that cycle and keep your mouth healthy for you and your child. The only time you should avoid brushing your teeth is if you're suffering from morning sickness and have just vomited. The acids from your stomach can weaken your teeth, so it is not a good idea to brush your teeth straight after vomiting.
I had no idea that brushing my teeth after vomiting would damage my teeth. I thought I was doing the right thing.
The best thing to do after vomiting is to rinse your mouth well with tap water. You can freshen your mouth by applying some fluoridated toothpaste on your teeth with your finger or chewing a sugar-free chewing gum. If you want to brush your teeth, make sure you wait for at least 1 hour after your vomiting episode to make sure you do not damage your teeth.
One of the best things you can do for yourself and your baby is to visit a dentist for a checkup, either before or soon after you become pregnant. And when you do go to the dentist, make it clear that you're either pregnant or planning a pregnancy so they can take all of the precautions necessary and also advise you on procedures that need to happen based on where you are in your pregnancy. Your dentist will always work with you to make sure you're as comfortable and relaxed as possible. Dental treatment can be done safely at any time during pregnancy. However, most non-urgent procedures are done in the 2nd trimester.
I thought it was dangerous to see a dentist when you're pregnant.
Me too.
It's absolutely safe to have dental treatment done while you're pregnant. In fact, it's much better to have any infections removed as soon as possible, rather than waiting until after the birth. It's not widely known, but mothers who have untreated dental decay can nearly double the odds that their children will have early dental decay after birth. And don't smoke during pregnancy. As well as all the proven health risks, smoking causes gum disease, tooth loss, oral cancer, and can increase the risk that your baby will be born prematurely. For smokers, gum disease is 7 times more common, and once it's established, it progresses much more quickly.
I'd love to give up smoking for the health of my son and myself, but it's difficult.
For advice on how to give up smoking, talk to your local health service or to healthcare providers such as midwives, GPs or Aboriginal health workers.
What about after my baby is born? How important is their dental health?
When a child's born, their mouth does not have any decay-causing bacteria. However, this can change with inappropriate feeding practices, such as sharing of a spoon, or when a mother transfers the dummy from her mouth to her baby's. These practices can cause early childhood decay, which is the most common chronic disease in children. Preschool-aged children who suffer from dental decay have increased risk of serious health problems, as decay can negatively impact on their eating, sleeping, speaking, learning and growth.
I didn't realise that dental decay can cause so many problems for my child. So what can I do to care for my baby's teeth?
Breastfeeding is really important in infant dental health care. If you are bottle feeding, don't put anything other than breast milk or infant formula in the bottle. And you're best to avoid developing habits like putting your baby to bed with a bottle, as this can lead to cavities due to the milk pooling in the baby's mouth and just sitting there. Use a different spoon to taste your baby's food, and always clean your baby's dummy with water if it gets dirty or falls on the ground. It is recommended that you don't use your mouth to clean it, as this can transfer bacteria from your mouth to the baby's and cause dental decay. Look at introducing a cup from 6 months of age and start cleaning your baby's teeth as soon as they appear, usually around 6 months. Always use a child-sized soft toothbrush, but no toothpaste is needed until around 18 months. Have your child's teeth checked at all child health visits, where most health professionals will do the lift the lip procedure, which is a quick visual checkup for signs of early tooth decay. This procedure can also be easily done by parents at home. And don't forget to take your child to the dentist by the age of 2. It's a common misconception that children do not need to see a dentist until they go to school.
Oh, that doesn't sound too hard.
We want what's best for you and your baby, and we have provided you with this evidence-based knowledge to help keep your dental health and your child's dental health in good shape at every stage of the way.
I think the main message you can walk away with is that it is safe to see a dentist during pregnancy, especially if you have a problem, and sooner the better.
So make sure you see a dentist if you're planning to become pregnant or early in the pregnancy for the best advice on how to keep your mouth healthy.
And remember that a healthy mouth and a healthy mother makes for a healthy, happy family.
So remember to maintain yours and your baby's dental health. You should eat a healthy diet and cut down on sugary foods. Drink tap water and try and avoid fruit juice, soft drinks and energy drinks. Brush twice a day with a soft toothbrush and fluoride toothpaste. See a dentist early during the pregnancy for advice on how to keep your mouth healthy. Dental treatment is safe during pregnancy. Quit smoking. It's best to breastfeed your baby and don't put them to bed with a bottle. Use a different spoon to feed your baby and use water, not your mouth, to clean their dummy. Brush your baby's teeth as soon as they appear and take your child to a dentist by the age of 2.